And I've personally expressed concern about the proposals for the CIC at the Petitions Committee, and I've written to ministers with a particular focus on the closure of the CIC clinic in Coatbridge. However, time limits today mean that I need to focus on the cuts to orthopaedics and trauma at Monklands. A decade ago, NHS Lanarkshire carried out a review of acute service delivery under the banner A Picture of Health, based on the Care report, and several of the options in that review involved downgrading Monklands Hospital, and if I could just remind the Cabinet Secretary, that was based on alleged safety of services 10 years ago, and none of those options actually proposed completely closing the hospital or indeed the A&E. But nonetheless, this attack on our local health services in Monklands was completely unacceptable to local people, as evidenced in extensive consultations, and it was unacceptable to local politicians, including me. The decision was devolved to the Health Board, but the Government has a duty and a responsibility to sign off major service changes. So, the Labour-Liberal coalition signed off that change, wrongly in my opinion, and frankly suffered the electoral consequences of that. I spoke out against my own party on this. I put down a motion on the future of Monklands as my last one before the election, and then I put down another as my first one after I was sworn in following the election. And I have no doubt that the SNP's election campaign to save Monklands helped them to victory in 2007. Indeed, it was actually printed on the ballot papers beside their candidates' names. Now, one of the downgrading options at that time, option D, specifically proposed to remove orthopaedics and trauma. So, that was meant to have been rejected when the newly elected SNP government demanded a rethink by NHS Lanarkshire, resulting in the status quo for Monklands. It was rejected, these proposals, 10 years ago. Only, it hasn't really been the status quo. The loss of paediatrics has then been added to over the past decade by a loss of gynaecology and dermatology, and heart attack patients are now treated at Hare Myers. And now what we see is a return to the downgrading of a decade ago, with removal of orthopaedics and trauma, again based on alleged safety of services, as the Cabinet Secretary pointed out in her opening remarks. And this all looks very much like death by 1,000 cuts to me. There is an opportunity right now to call in the current cuts proposals, to properly consult and to think again. And as for the proposal to build a new Monklands Hospital in 7 years' time, that investment would of course be welcome, but maybe the Minister can clear up some questions. Where in our Government's budget planning is the 400 million? What does she say to the health professionals who say that a new acute hospital would cost at least double that amount? And where is it going to be built? If there's a cost identified, the detail of that must surely be known. In fact, Philip McGregor seems to know it in today's Advertiser, so maybe that could be shared with the rest of us. The promise of a new hospital cannot be used as a smokescreen to cover up the current threat of the downgrading of orthopaedic and trauma. So let's have a look at what the facts are about the current threat. Orthopaedic, inpatient and trauma are being taken away from Monklands Hospital to be delivered instead at Wishaw and Hare Myers hospitals, at least an hour away on public transport, with no new transport arrangements proposed for patients, for example, with limited mobility. And that's going to be for at least 7 years, apparently. This decision was taken during the summer recess with no prior public consultation, and the staff were issued with their redundancy notices. And due to this, Richard Leonard and I organised a public meeting to try and get public engagement with the Health Board. I would actually expect them to come to a meeting organised by MSPs, but they chose not to attend the meeting, and they cited lack of consultants at short notice. Well, I didn't ask for a consultant, I asked for one of their board members and/or a senior official. However, it is important to hear the views of medical professionals, particularly those who have experience of working in Monklands. Orthopaedic surgeon Sather Thajam, who's worked at the Monklands for 30 years, calls the plan ill-advised, ill-thought-out, badly planned and totally unnecessary. And he goes on to say, the argument that Mr Callum Campbell and the Lanarkshire Health Board put out continually, saying that there will be no disruption to the care of the elderly and the young following the closure of the orthopaedic and trauma unit at Monklands Hospital, is, in my opinion, frankly ludicrous. And having spoke to other staff privately, I know we could hear similar from more of them if they weren't worried about speaking out. Some consultants have actually spoken out. 6 at Wishaw, who said it's impractical to shunt patients about Lanarkshire in ambulances, and 7 orthopaedic surgeons at Monklands who have made the case for it to stay at Monklands. So, the SNP government can and should step in to stop this major service change, and I believe they've got a duty to do so. At the very least, the plans must be halted until a full consultation on this specific issue is carried out. And a meeting is a start, but the people of Monklands deserve to know the full facts. Presiding Officer, at what point does the downgrading of Monklands Hospital end? Do the government really think that people are going to accept promises of jam tomorrow, which are frankly designed to try and disguise cuts today? And at what point do SNP constituency members put the people they serve first and demand that their government steps in to stop these cuts? I did that a decade ago. I stood by my principles and I did that, and they should do it now. Now, we know this issue featured heavily in the recent Coatbridge and North Glenboy by-election, with Labour's Alec McVeigh elected on a promise to oppose cuts to Monklands. That sent a clear message that people care about their vital local health services, and increasing numbers are joining the campaign to save Monklands Hospital. The least they can expect is for the government to call this in, and some of them are in the gallery today from that campaign. I've got no doubt that People Power can and will win this battle to save services, and we on the Labour benches will be standing firmly with them to stop these cuts. I hope other elected representatives will do so too.